Hello there. Thank you for checking out another edition of R&R's Ask the Expert. Today, I'm very excited to be joined by Dr. Gene Cole. He is the Director of Research at LRC Indoor Testing and Research. He's also a member of the Science Advisory Council of the Cleaning Industry Research Institute and a fellow of the AIHA. So he has a lot of insights to offer us for the COVID-19 or coronavirus pandemic. So I'm going to toss it right over to Dr. Cole and ask, so do you have any comparison for this pandemic compared to past pandemics that we've had?
Well, yes and no. Every pandemic is different. But what we know from other respiratory disease pandemics is what we're doing now, emphasis on hand washing, social distancing, which now is a new way of life for us, and then disinfection. But now more than ever before, we're looking at cleaning and disinfection. And cleaning is something that really has been in the forefront over the last, well, at least 20 years or more. I've interacted with the cleaning and restoration industry now for, it's 30 years this year, just as a volunteer on standards committees and being involved in research relative to cleaning, remediation, restoration. We had a pandemic 2 years ago, the cold and flu season of 2017 and 18. And I think most people weren't even aware of it or aren't today, but it was a terrible pandemic. And let me preface it by saying that we have an influenza pandemic every year. So we have several strains that circulate. There's type A and B flu viruses. A are the worst. There's always at least one A, and then one or two Bs, which can be very serious as well. But in 2017, 2018, cold and flu season, we had 45 million Americans infected, with over 800,000 hospitalized and over 60,000 deaths. So compared to what we're seeing now, that was, much more horrendous than what we're seeing now. How come back then, 2 years ago, we didn't have travel bans and event cancellations, and businesses closed and so forth? Well, because it was the flu. The flu comes around every year. People are used to it. They either get a cold or they get a flu or they get both. They hopefully get their flu shot, which is a measure of protection. People during cold and flu season, if they experience respiratory problems, then they tend to self-treat. If it gets worse, they stay home and again, self-treat. Unless it really gets serious, they don't seek medical attention. And so with the flu shot, even though that particular virus wasn't included in that year's vaccine, the vaccine every year does offer an amount of cross protection, cross immunity, as we call it. Plus, those of us that are older, we've been on Earth for a while, we've been exposed to flu viruses decade after decade. And so maybe there should have been more done in terms of public control and prevention of transmission. But just to finish up on this one question in particular, this is a coronavirus, COVID-19. It's the 7th coronavirus to affect humans. 4 of them been around for a while, and they're cold viruses. Can still be serious, but nothing to the extent we're seeing today. Then in 2002 and 3, we had the SARS epidemic. Well, much higher mortality rate. It didn't spread like COVID-19 is spreading right now. It was mostly transmitted to those in close contact with the people who exhibited symptoms. And so healthcare personnel in particular. And unfortunately, they had a 21% mortality rate. Usually, infected individuals who traveled somewhere and became ill passed it on to caregivers. So it wasn't like what we're seeing today with sustained transmission. Mm-hmm. Then we had MERS, another coronavirus. That was number 6 to appear on the scene. And even higher fatality rate, 35, 36%. Fortunately confined to the Middle East. Again, no rapid sustained transmission from person to person. And so it's still considered an epidemic rather than a pandemic, although cases still pop up now and then throughout the world. So going back to SARS, after that coronavirus had emerged, attempts were made to develop a vaccine. And for the past 7 years, they were not successful. And so it was trial and error and so forth. So if we had a vaccine, by now it would be mass produced and we'd all be getting it. And we wouldn't see the case counts and the death counts that we see now. However, there are more than one vaccine right now that's in development. There's at least one already in clinical trial, the first phase. And those 7 years of research looking to develop a SARS vaccine has provided a lot of information to facilitate the development of this one. So we have a lot to learn from, and we have from past pandemics. This particular virus is one that's highly infectious, and it developed a mutation that accounts for that transmissibility. In my opinion, everyone on the planet will at some point in time be exposed to it and will have no symptoms or problems and recover. Some may have mild symptoms and recover, and some, again, with multiple risk factors, will have serious disease, and some of those will die. There's always a second wave in terms of a viral pandemic. And so all of those of us who are quarantined right now, when the word is given, resume somewhat normal business, will likely be exposed if we haven't already. And again, we'll see disease counts and we'll see death counts go back up, but then things should subside. And hopefully by next year or middle of this next coming flu season, we'll have an effective vaccine. So we learn a lot from past pandemics. We're applying it to this one. But in terms of why we're talking today, never has it been more important to address transmission in view of cleaning as well as disinfection.
So what are some of the things then from these past pandemics that things that experts know that need to translate into cleaning protocols to make sure that we're doing effective cleaning and stuff like that now?
Yes, well, first of all, the emphasis is on cleaning. And excuse me, I was fortunate back in the early 90s to work with Dr. Michael Berry, who at the time was the first indoor air quality manager for the EPA. And he and I did many research studies together that involved the cleaning and restoration industry. He had a particular interest in that industry, and of course, he still does. And he brought forth the concept of cleaning for health. And we could say cleaning for health clean for health first rather than appearance. So, I mean, for eons of time, those responsible for example, building cleaning and maintenance, floors had to shine and sparkle. And it has taken decades and many years and struggles to get those individuals who are professional cleaners to understand that that's not the main vehicle of transmission of infectious agents. It's what is touched and handled most frequently, what we call high contact touch points. Yes, floors need to be cleaned. Certainly, let's sweep them. But the second concept that's really come forth in these last 20 to 30 years is that you can't determine what's clean in this sense too, meaning the absence of microorganisms, just by looking at it. If it looks clean, well, it may not be clean microscopically. There can still be residues of microorganisms that are there just because someone put their hand on a desk or on a door panel or something of that sort. And then we all know about restrooms, and hopefully today, and I think we do, have those who have responsibility for cleaning restrooms, which I heard recently referred to as waste transfer stations, uh, which is true, effectively understand how to clean those. But it's not just sinks and toilets, but now it's all surfaces in a restroom. It's the stall door handles and panels and doorknobs and everything in that restroom. So cleaning is important. We've known, again, for decades. We all tout EPA approved disinfectants, for example. We look at the label claims, and most of those have always said, as many still do today, use on a clean surface. So cleaning is the major emphasis. Physically remove what Mike Berry said is unwanted matter, which contains microorganisms, and in our case today, infectious agents. Remove as many as possible through the process of cleaning, then apply an appropriate disinfectant to inactivate whatever remains. So in today's times, well, let's just go back, for example, and you were talking about pandemics, but I can remember back in the fall of 2001, the anthrax attacks, October, November of 2001. This was right after 9/11. And so, I mean, we had enough excitement due to that. Now we have people opening envelopes with white powders in them being exposed. We have people hospitalized and dying. And so certain individuals, including politicians, got some of these envelopes with anthrax spores. And I can remember when it was determined that the Hart Senate building in Washington, D.C. had been contaminated. And so immediately the EPA was called upon, do something. And so they checked, and they had a company already under contract and said, come decon this building. And they went in and they saturated the entire building in chlorine dioxide. Well, it smelled very nice. It's a good deodorizer. But they were dealing with bacterial spores. You're not going to clean them with short contact or dwell times. Not only that, you're not going to get it everywhere. And so I was just really incensed by this, and a colleague of mine, we got together and said, you know, let's set the record straight. And we actually drafted a paper, and it was published, where the emphasis was bringing in fully protected workers. In that situation, a hazmat team, fully trained and protected, to go in and physically remove lots of HEPA vacuuming everywhere they possibly could, lots of air scrubbers. Yes, you can go back in then if you want, and you can fog a biocide, but in reality, nothing's going to mean more than physical removal of those spores. And we were fortunate at that time to have a somewhat rapid method of assessment of the effectiveness of that cleaning procedure, which was rapid PCR. We could get analysis and determine if the dust we collected contained anthrax spores or not. And that was, and I remember doing a clearance protocol where I said, okay, in this situation with anthrax, it's a deadly human disease, tolerance is going to be 0. So if you take 200, 300, 400, if you get one sample that's positive, you're going to have to re-clean. But, and this brings in another concept, was it possible in any of those anthrax contaminated buildings to remove every single spore? And the answer is no. The key is, with effective cleaning, you reduce the number of spores below what we refer to as an effective dose. It takes a lot of spores to initiate anthrax, especially pulmonary anthrax of the lungs, which is typically fatal. And so when the attacks occurred, I went back into the literature and brought up the original studies that had been done with primates in confined laboratories. And that research led to an infective dose of somewhere between 5,000 and 7,000 anthrax spores. That's a lot of spores. Certainly, it's in a pre-cleaned building. There's going to be a lot more, in the hundreds of thousands to millions of spores. But after cleaning, if we get it down to where we can't detect one in hundreds and hundreds of samples, that's the best we can do. And we're below the infective dose for any particular individual. So that gets back to previous pandemics or outbreaks. That was an outbreak, and again, an emphasis on cleaning. We want the biocide, the disinfectant, to work properly, but it's secondary to effective cleaning.
Okay, so for companies that are sending crews in to do this kind of cleaning, what do you recommend to make sure that they're hopefully helping their crews stay as safe and healthy as possible throughout all of this?
Well, there's a number of things. First, education and training. They need all the information that's available about this particular pathogen, how it's transmitted, what the symptoms are. We don't want people to be afraid. Mm-hmm. And I'm sure there's some cleaning and restoration companies across the country whose workers, aren't showing up, or they're saying they're going to stay home until things settle down and that sort of thing. But I've already been involved in asking or in responding to requests from companies to help them with protocols to go in and do coronavirus cleanup. And so first, educate the crew, and then, of course, have them properly protected. And in this situation, and myself and my firm have already dealt with this, with calls from remediation and restoration companies who say we need a protocol. We have 1 or 2 people in this 4-story building that's tested positive, so we're going in and we're going to clean. And can you help us out? So we've developed a protocol, as well as an approach to assessing cleaning effectiveness, which maybe we can address a little bit later. It's education about the organism, how it's transmitted, symptoms, in case anyone is concerned. If they have the sniffles, does that mean they're infected? Well, we have more testing is available now, and so that probably would be done in that situation. Protection, absolutely. So we're talking coveralls, we're talking respiratory protection, effective respiratory protection. In this case, most likely half or full face respirators, certainly at the very least N95s. We're talking about disposable gloves. Now, I've spoken to a number of contractors recently and people on various committees dealing with coronavirus in the industry. They like to go in and fog first. And some of them do that because, again, it smells nice, it deodorizes, and it helps allay the fears of some of their workers, knowing that, okay, we've gone in and, we may have hit some viruses here and there, and at least they feel it's an extra layer or measure of initial protection. Somewhat analogous to remediation of sewage backflows, which, even though the biocide is going to be neutralized with all that sewage, they like to still go in and blast it and get it knocked down a little bit, and then do the cleanup. And then, of course, you've got to apply your disinfectant again. So proper protection is essential, understanding the virus, and then from there, it's actual cleaning practice. And this has to really, the best is by hand. Trigger sprays in particular, understanding cleaning in the past few years, doing more and more cleaning related research, and seeing the data that myself and other colleagues of mine have been generating. It's so important to make sure that on a particular surface, maybe we're talking about minimally 1 square meter, using a single cloth, folding it multiple times. Again, whatever's on that surface. I've been doing a study in public schools for the past 2 years, and you can imagine what's on the student desks as they drool and wipe their noses and spread it on the surface and on and on. And nothing is more important, and we've demonstrated it with data, intervention versus control schools, the effectiveness of cleaning in knocking down the microbial loads on those desks. The other thing, maybe I'm getting ahead of some of your questions, I'm not sure, but in terms of cleaning, great research has come out in the past 3 years relative to frequency. How often should you clean? In terms of normal microbial repopulation of a surface that's been effectively cleaned with a detergent solution and then a disinfectant or a one-step cleaner disinfectant, how long will it take before the contamination level from normal skin bacteria, nasal secretions, coughing, sneezing, whatever, comes back to where it was before it was cleaned? Now we know it's within 72 hours. So when a company is called to come in and do a coronavirus cleanup, their recommendations to management should be, okay, we've done the cleanup for you. You have to keep it up. And so, every 2 days or at the most every 3 days, you go back and basically do the same thing that we've just done on high contact touch point surfaces. And we're talking about everything. So it's desks and tables and countertops, it's drop pulls and door handles and touch plates. We just generated some post-cleaning assessment from a company that went in, apartment complex. They had a positive coronavirus individual. And the unfortunate thing was that we didn't get in there until 35 hours later, where we called to go in. But in the 35 hours, the elevator buttons were extremely contaminated already. Everyone's touching. I mean, nobody touches an elevator button with their elbow or, something like that, or a screwdriver, handrails for stairs. So somebody says, well, I don't want to take the elevator, it's going to be too contaminated. Well, don't touch those handrails either. So the importance of frequency just cannot be overemphasized. And that should be passed on to who's ever managing that building. Or I know there's cases where management companies have called and said, we have a tenant who leases a complex of buildings. And according to their lease, they are responsible for cleaning using their custodians. And so their custodians are going to do the cleanup. And what do they do next? Well, that's when I bring in, everything about how they should do the cleanup, if this is what's going to happen. As I mentioned before, the PPE and understanding the virus and the high contact touch surfaces and so forth. And, but then cleaning frequency. One thing too, in educating and training those who are going to do cleanup is that, and you and others keep hearing this, and it's true, as I've looked at the virus, this is an RNA envelope virus, all coronaviruses are. They have that lipid envelope around them. It makes them very susceptible to detergents and disinfectants. Actually, even soapy water will inactivate coronavirus. This coronavirus, the cause of this pandemic. It was the same with HIV years ago. Of course, that's a bloodborne pathogen, primarily, transmitted by blood and body fluids, but concerns were, suppose blood gets splattered on a benchtop in a lab or whatever it might be. Yes, it will survive for a few hours, but even if you just have again, protective equipment and then a bucket of soapy water to clean that surface, you're going to be fine. So all of these are important things to know. I do like to, well, let me turn it back to you for other things that we need to get to.
Sure, sure. Okay. So I really just have maybe one more question, and it's if there's anything that you feel like cleaning and restoration companies really aren't understanding or really do need to make sure that they understand during this specific pandemic.
Well, I guess, there's always a few things. We'd all like to be on the same page. You're probably aware of the recommendation that if someone in a building has tested positive, that building is evacuated, and it should be 24 hours until cleaning crew comes in. And I would agree with that. I don't have a problem with it. We know that this particular virus has optimum temperature and relative humidity requirements, but in reality, we know it survives at all regular indoor environmental temperatures and relative humidities. So we're not going to turn the heat up and try and bake out the building. This is like dealing with VOCs and high emitting building products and materials. So that's not going to work, but allowing it to sit for 24 hours and stabilize with the HVAC system off probably will reduce the burden of the virus to some extent, depending upon where it is, what it was deposited in, and that sort of thing. Viral die-off can begin at that point in time. We know it survives, well, on certain materials, days, others, hours. Paper products, cardboard, cotton cloth, an hour. There's very little studies have been done to this point with this virus, but with other viruses and other coronaviruses, an hour at most on cotton cloth. So things that you can launder, fabrics and materials. Questions come up, what do I do about upholstered furniture? Well, there's real limitations there, but again, I would get back to emphasizing physical removal and HEPA vacuuming. And there's wisdom in using air scrubbers while all the cleanup is being done. The HVAC system is off. Now, I've heard some companies say, well, seal off your return and your supply registers. Well, I'd like to see the supply and return registers cleaned. In actuality, the system is off. Certainly during this cleanup process or immediately thereafter, we need to get the HVAC professional in there to assess, has this system been properly maintained to this point in time? Take a look at the filter banks, maybe do a video of the ductwork, that type of thing. What needs to be done in terms of cleaning and remediation of the ductwork? And so that is a specialty area for HVAC professionals who need to be involved at that point. Again, cleaning for health first rather than how it looks. So yes, floors need to be cleaned as well, but again, those are not high contact transmission surfaces. So everything that anyone touches, the break room, oh my goodness, not just the handle on the fridge, but the entire fridge, not just the handle on the microwave, but the entire microwave and everything in that break room. Why heavy contact transmission of whatever has been on people's hands and fingers and so forth. Again, maximum attention to restrooms. Why? Because high humidity due to sinks and toilets and so forth. And if these happen to be buildings with high pressure toilets, that's a problem. And even at home, and some of these old recommendations that we've been aware of for decades are starting to resurface, where last week somebody said, yeah, even in your home environment, before you flush the toilet, put the cover down. Well, in commercial buildings, you don't have covers because when you flush and it's high pressure, it develops aerosols that are generated. And studies were done decades ago where graduate students seeded viruses in toilets, flushed them, came back hours later and could recover the virus from stall doors and panels and that type of thing. So a lot of attention to restrooms. And then we're getting a lot of calls and questions about, okay, after we've done everything we can in this building in terms of coronavirus cleanup, how do we know we've done a good job? Well, you know what you've done and how you've done it. And, you know, that's, to me, 99% of it. But a lot of them are asking, okay, is there any kind of testing that can be done? And the response is always no, there's no specific coronavirus test or test for any virus on a post-clean surface. Now, you can test for a measure of cleaning effectiveness. And I have been asked recently, and a number of my colleagues in the research arena have been asked questions about rapid test methods. Of course, a lot of these, well, all of them really have come mainly from the food industry. You know, rapid protein tests, food processing plants. ATP has kind of risen to the top. But to use ATP, you have to be familiar with one particular system. There's several available commercially. And then you have to have some type of baseline. And if it's a building that no one's ever been in before to do a thorough cleanup, they don't have a baseline of that building. If a company has used ATP previously and they have a baseline, and it doesn't have to be pre-cleaning data either, it can be post-cleaning. So if every building they've done in the last 5 years, they've gone in and taken 50 or 100 samples, well, by now they have a baseline that can be helpful in determining how effective the cleaning has been. And recently, the first protocol that we gave a company who wanted to have us come in and do ATP post-cleaning effectiveness assessment, had to understand that we have, just from our research studies that we've been doing, a very good hard surface baseline. And so we went in and we did the high contact touch points. Like I said, the elevator buttons were sky high, and handrails and so forth in particular. Other surfaces, fitness room, exercise equipment. Oh my goodness. I probably want to say right now to companies doing remediation or restoration in these buildings, you know, just clean twice to begin with on these exercise machines. The handles, the buttons, everything that people touch in those environments are going to be heavily, heavily contaminated. So you've got human skin cells, that's protective of viruses. You have sweat. I mean, we won't go into all the other body fluids that might be there, but extra emphasis. And so we were able, just with, it was less than 100 samples, pinpoint areas where we said, okay, you need to go back and re-clean, like now. And on-site, rapid results, you know, data within a minute, and that's been very useful. It's not necessary that everyone do that, but, and the last thing we're all familiar with in remediation and restoration is document everything that's done. And of course, at the beginning, it's always, you know, assess the scope of the job. And, you know, obviously you're going to give first attention to where that positive individual was in that building, but then you're going to clean the rest of the building the same way. So address how you clean surfaces, use a detergent cleaner followed by disinfectant, or one-step cleaner disinfectant. If they would like to go and fog again, that's their option. It's just additional time and some cost, although the cost might be minimal. So taking all of that into consideration, and again, reminding management when they're finished that you folks need to keep this up. Pandemic's not over, And, you know, you have your custodians, your janitorial staff, bring them up to speed on what they need to do. And, you know, you have the report of what we did. They can begin to do the same types of things using effective products and keep this building in the state that it is now.
Perfect. All right, Dr. Cole, thank you so much for, this was a wealth of information. I am so thankful for all of this that you're able to share with the cleaning and restoration industries. Thank you so much for your time today. I certainly appreciate it greatly, and stay safe and healthy. Thank you for all you're doing.
You're very welcome. There'll be a test next Tuesday.
I will study between now and then. I learned so much during this. I'm very thankful, so I can't wait to share this with our readers. Thank you so much.
Yeah, I'm sorry. Sometimes the professor part of me comes out, and I wind up, I'm lecturing, but there's so much information. You know, it's easy to say clean and disinfect, but there's so many different aspects of that we need to effectively understand. And then, you know, how do you know you've done the right job, and so forth. And let me just add, one of the most important things in terms of cleaning, and we're doing this hand surface cleaning, are the cloths that are used. They can be disposable, they can be reusable. Microfiber is great, and they can be reused, but you've got to use an individual cloth in a small area, fold it as many times as you can. Again, our ATP studies have shown, and when we did this recent post-cleaning assessment, I had our team do duplicate samples very close to one another. And quite often we found in our research in school buildings, for example, we'll have a very low value on one, and then just a few inches away, we get a high value on another ATP value. So what has happened there? Someone was cleaning, and then they lifted their cloth too soon, or it wasn't effective cleaning, and they smeared whatever the contamination was. So most of that surface is clean, but they left a streak of something that we can pick up with that ATP assessment. So the way this is cleaned is very appropriate. When we started with our school building cleaning and disinfection research a long time ago, it took a while to get the custodians to understand that when you walk into a classroom and there's 25 student desks, you can't clean all 25 with one hand towel. You're spreading things, you're smearing, you're not cleaning. Okay, so one cloth per desk, fold it, and keep moving and understand. And those can be disposables or reusables, but that hand cleaning process is the essence of what we're talking about here.
Perfect. I love it. You had so much to share. We can go with Professor Cole, Dr. Cole, all of it. I love it. Thank you so much for your time. I really appreciate it.
You're very welcome, Michelle.